So what happens in therapy? It's a great question because therapy happens behind closed doors and is therefore a little mysterious. So therapy is all about trying to figure out why patterns of behaviour and unhelpful emotional difficulties and thoughts about yourself or the world have got stuck in the way that they have, and why you feel blocked from living the life that you really want to live. So once you come to see a therapist, you're both being detectives, trying to understand why that is, figuring that out, piecing the pieces together from your past that feel relevant, and then figuring out a new way together. So some of that involves the therapist giving you information so that you know more about yourself, how you tick, given all the research into human psychology, and then also maybe teaching you the skills and tools that you need to overcome difficulties, so that you've got certain techniques to put in place when you hit those usual roadblocks or stuck feelings. So lots of support, lots of practice, lots of goal setting, and for some people as well, once you've covered a lot of that stuff, there might also come a point where you need to process old traumas. So that might be things from your childhood that have never really had airtime because they felt very difficult to think about or even talk about. And the reason that you might do that with a therapist, because the symptoms that you're getting in your everyday life are actually coming from an old wound. So you'll know that if you have a sense that the way you react is a little excessive for what the current situation is. And that's then suggests that, yeah, you need to go back with the therapist and then gently unpack that wound, trauma, that pain point, and make sense of it in a way that fits with your adult view of yourself and your adult brain, because often it's a very old child hurt part that's still feeling that pain. So that's never done until you're ready to do it, and those early sessions are all about preparing the ground, and sometimes that early session stuff is all you need and there aren't extra traumas that you need to unpack, but I'm giving you a little flavour of what different therapies might look like. If you suspect that you might benefit from therapy but you feel a little blocked, then go and watch my second video, which is all about that.